So this is our wrap up, and this presentation was adapted from the Leading and Managing in Nursing textbook, chapters 17 and 25. It's by Yoder, Wise, and Sportsman, and it is available to you on your bookshelf. So learning outcomes are examine various technologies and how they can play a role in impacting patient safety and quality. Provide definitions for the core components of informatics: data, information, knowledge, and wisdom. We'll revisit the Nelson model. Compare and contrast the different types of technology for capturing data at the point of care. Apply how decision support systems have impacted patient care in your lived experience. Explore the issues of patient safety, ethics, and information security and privacy within information technology. And then ponder projections for the future and what they mean to the practice of nursing. We're talking about technology. We're talking about healthcare's future. Technology will help facilitate decision making, improve efficiency and efficacy, enhance patient safety and quality, and decrease healthcare costs. The success of nurses using biomedical technology, information technology, and knowledge technology contributes to patient care delivery, outcomes, and clinician experience and efficiencies. Looking at the Tiger Initiative. Tiger Initiative is a collaborative effort to integrate health informatics into nursing education and practice, preparing nursing for a technology-driven healthcare environment. Its goals include developing essential informatics competencies, promoting evidence-based technology use, and ensuring nurses can leverage information technology to make healthcare safer, more effective, and patient-centered. Competency in informatics and healthcare technology is required for nurses in today's healthcare environment. The American Associations of Colleges of Nursing Baccalaureate Essentials has devoted an entire competency domain to this topic. The Essentials describe competency in informatics and healthcare technology as the use of information and communication technologies and informatics processes to provide care, gather data from information to drive decision-making, and support professionals as they expand knowledge and wisdom for practice. It's looking at basic computer competencies, information literacy, and information management. We look at the types of technologies. Information, we have point of care and smart technology. Might be our diagnostic testing that we do, intravenous fluid and medication administration, where you're using something like a smart pump, and therapeutic treatments. Some wearable technologies, and we've talked about more than just these, just rhythmia monitors, vital signs monitors, glucose monitors. When we look at information technology, healthcare is an information-intensive and knowledge-intensive enterprise. Information technology can help healthcare providers acquire, manage, analyze, and disseminate both information and knowledge. Healthcare in the 21st century should be safe, effective, patient-centered, timely, efficient, and equitable. Computers offer the advantage of storing, organizing, retrieving, and communicating digital data with accuracy and speed. Patient care data can be entered once, stored in a database, and then quickly and accurately retrieved many times and in many combinations by healthcare providers and others. Talk about knowledge technology. This consists of the systems that generate or process knowledge to provide clinical decision support. Examples are dosage range calculators, allergy alerts, best practices for managing patients. We'll get to it in a minute, but this is the wisdom piece. This is what comes after knowledge and brings it to the wisdom piece. It is bringing you the opportunity to think like an expert when you might not be an expert yet. You still might be at that novice level. Clinical decision or diagnostic support systems are interactive computer programs designed to assist health professionals with decision-making tasks by mimicking the inductive or deductive reasoning of a human expert. The basic components of a CDS include the knowledge base and the inferencing mechanism, usually a set of rules derived from the experts and evidence-based practice. The knowledge base contains the knowledge that an expert nurse would apply to data entered about a patient and information to solve the problem. One of the benefits of CDS is that they permit the novice nurse to take advantage of decision-making expertise and the judgment of an expert. This is just an example of the expert decision framework for giving maximum dose of pain medication. So our knowledge base is the pain score, the invasive procedure scheduled, the opiate analgesic ordered, contraindications to the medication, history of allergic reaction to opiate analgesics, contraindication to the maximum dose of opiate analgesic, time since last dose of opiate analgesic administered, and time since surgical procedure. So the inference engine takes it and says you can give the maximum dose of pain medication if A or B and C and H are less than 48 hours and G is greater than 3 hours, and not D, E, or F. C and H is less than 48 hours and G is greater than 4 hours, and not D, E, or F. So that was a lot of processing of a lot of information. And what technology does is it puts these things in an algorithm so that you don't have to do the A, or you don't have to do in your mind thinking about A or B, then C, then D. It kind of spits out, if you will, the time frame for giving maximum dose of pain medication. You're doing that in your mind. You just don't really think about all that you're analyzing and the time that it takes to do that. When we're thinking about this same topic, medication management process, we talk about the computer provider order entry system, computerized provider order entry system, decision support and clinical warnings, i.e. alerts to the provider of allergies, pertinent lab data, drug-to-drug and drug-to-food interactions. Can give them an automatic dose calculation. I want to give 15 milligrams per kilogram of this medication. Link them to up-to-date drug reference material. Looked at that with the lexicon. Automatic order notification. Standardized formulary compliant order sets. So order sets are designed with medications that are within the hospital's formulary. Medications orders are legible, accurate, and complete medication orders. And that was not the case when we were doing handwritten medication orders. Seemed like something was always left off or something was illegible. We were trying to decipher it. It decreases variation in practice. If we're all doing it the same way, using that 15 milligrams per kilo automatic dose calculation and that type of thing, there should be less variations in practice. Less time with clarifying orders, because you won't need to as much. It impacts fewer verbal orders, and no manual transcription errors. When we look at the EMAR, the electronic MAR part of this medication management process, we have integration with clinical documentation in the electronic record. So it goes right into the record as we administer that, and that's in real time. It gives us a link to up-to-date drug reference material. It gives us automatic reminders and alarms for approaching or missed medication administration times. Prompts for associated tasks or additional documentation requirements. Alert when cumulative dosing exceeds maximum. So Tylenol, the maximum dose for that in a 24-hour period is 4,000 grams. So that will alert the nurse that, hey, this patient has taken more than 4,000 grams. And because if you actually figure out if somebody is allowed Tylenol every 4 hours at 1,000 milligrams or even 650 milligrams, if you gave it to them that full 24 hours, they would actually go above the maximum dose that is allowed. It's a legible record. It's accessible to multiple users. Proved accuracy of pharmacokinetic monitoring. Administration times are reliable. We're doing it in real time. So if I'm getting a trough level of a certain medication and I'm questioning the level that I got, I can look at actually the medication record and see when that medication was actually given so that I can know, yes, this is a reliable trough level. Record matches the pharmacy profile. Generated reports to track medication errors with visibility of near misses. Perpetual interface with pharmacy inventory system. So this is huge. This is allowing pharmacists to know how much medication they have on hand and when they would need to order it. And increase the accuracy of charge capture at the time of administration or when the drug is dispensed. And then on that same topic, barcoding and radio frequency identification. Medication documentation captured electronically at the time of administration. Medication rights are verified. The right patient, correct? The right, because I'm scanning the patient. Is this the right patient? Is this the right dose that I'm giving? Again, positive patient identification. Clinician alerted to discrepancies. Wrong drug, wrong dose, wrong time, wrong patient, expired drug. And automatic tracking of medication errors and provides visibility to near misses. When we think about this same topic in the automated dispensing unit or cabinet, the PICSs. This is a secure drug storage area, controlled user access, interface with the pharmacy profile, access restricted until order reviewed, quick access once medication order reviewed by pharmacist, ability to monitor controlled substance and waste and utilization patterns, perpetual interface with pharmacy inventory again. And our pharmacy automation and robotics is increased accuracy and speed of dispensing. If it doesn't have to go through all of these different hoops, we're going to get the medication faster. When we order medications in the infusion center, the patient comes in, we release their medications, we ask them, the pharmacy, to bring up that medication. They have that medication in the computer that they can look at. Someone just needs to check it, verify it's the right dose, and send it up. It's hugely sped up how soon we can get those medications. We're thinking about information systems. We talked about all of the issues that can come with a manual system versus a computerized system. And all the complications that can come. Networking computers, ideally data is recorded at the point in the care process where they are gathered and are available to healthcare providers when and where they are needed. This is hugely important. The fact that charting an electronic record is real time is huge. When we talk about meaningful use, Medicare's Meaningful Use Program, now known as Promoting Interoperability Programs, refers to the criteria healthcare workers must meet to demonstrate the meaningful use of certified electronic health records, to improve safety and care, to improve quality. To achieve this, providers must use EHR technology in a way that includes e-prescribing, exchanging health information for care coordination, and submitting clinical quality data. Meeting these requirements ensures that the use of EHR goes beyond simple data storage to actually improve quality, safety, efficiency, and health outcomes. We talk about information systems quality and accreditation. Quality management and measurement required for accreditation and licensing of healthcare organizations. The Joint Commission evaluates and provides accreditation that includes standards for the EHR. Remember that the Joint Commission is an independent, not-for-profit organization that evaluates and provides accreditation and certification for more than 22,000 healthcare organizations and programs in the United States. Accreditation and certification by the Joint Commission are recognized nationwide as symbols of an organization's commitment to meeting performance standards focused on improving quality and safety of patient care. So everyone gets really scared when they say we're going to have a Joint Commission evaluation. Children's Hospital has been waiting for theirs for several months. They keep saying they're coming and they don't come, and we're waiting till next month and next month. They assure us that it will be in the month of December. And we really shouldn't be scared. If we're doing the right thing, then we shouldn't be scared. No one should be scared if they're already doing the right thing. Nursing informatics, a specialty that integrates nursing science with multiple information and analytical sciences to identify, define, management, and communicate data, information, knowledge, and wisdom in nursing practice. Revisit the Nelson model. That really is the explanation of how information technology works in a healthcare system. You have data. A temperature is 98.3. Okay, that gives us information. Like this person probably has a fever. It adds to our knowledge. People with infection generally get fevers. And then it helps us with the wisdom piece. If I've got this going on, so I'm just talking about temperature, but if the computer also pulls respiratory distress or something like that, it will say, hey, this patient probably needs such and such. And that's the wisdom that you get from that expert piece that all nurses may not have in the beginning as they are novices. Elements of an ideal hospital information system. Data are standardized and use structured terminology. We've talked about terminology a lot and making sure that we have standard terminology so that when I say respiratory distress and difficulty breathing, we're both talking about the same thing. The system is reliable, minimal scheduled and unscheduled downtime. Applications are integrated across the system. You want to make sure that all the applications that you're using, pharmacy, laboratory, x-ray, all they are integrated into the system. Data is collected at the point of care and then available. The database is complete, accurate, and easy to query. So like I said, you'll see some items on Epic that might have a $ sign or might just look a little bit different than others. Those are things that are often traced. So if I want to know how many people are on ventilators at Christ Hospital at any one time, I can pull that from all the EHRs that are in the of patients that are in the hospitals and be able to tell you there are this many ventilators in use at Christ Hospital. Data are gathered by instrumentation whenever possible so that minimal data entry is necessary. Trying to do that, that transference using instrumentation is best, and that's so that we don't have those errors, those transcribing errors that can happen. The system has rapid response time. The system's intuitive and reflective of patient care delivery models. The locations facilitate functionality, security, and support. That's kind of been a hot topic now in having people now be able to use a hand device to administer medication for somebody who maybe is not in their bed right next to a computer. Screen displays can be configured by user preference. I see that all the time. Somebody's Epic doesn't look the same because theirs is more colorful. I've never gotten creative enough to do that, but you can. You can decide what views that you want. And the system supports outcomes and an evidence-based approach to delivery of care. It has those clinical decision supports embedded in them, so that when somebody does have a temperature and does have a fever and their white blood cell count is this or that, it helps support by giving you a CDS, and that would be the care that we would provide would be evidence-based. Patient safety, impact of clinical information systems, impact on communication, patient care documentation, and impact on medication administration process using a CPO or barcoded technology. Communication and information difficulties are among the most common nursing workplace challenges and are frustrating and potentially dangerous for patients. Effectively designed and implemented information technology has the potential to improve patient safety in the healthcare setting. Talk about safely implementing healthcare information technology. Any form of technology has the potential to adversely affect patient care safety and quality if designed or implemented improperly. The success of implementation of technology requires a shared responsibility and multifaceted approach, looking at people, processes, environment, and technology. This is looking at that socio-technical model that we've looked at in the past. It's not enough just to have the device. You have to address the people that are using that device also, and who is willing to use it. When we talk about Rogers and his looking at people's willingness to adopt technology, that all has to come into play. Look about professional ethical nursing practice and new technologies. Nurses are professionally obligated to maintain competency with a vast array of technical devices and systems. A new piece of equipment comes to the unit. It is your responsibility to learn how to use that piece of equipment so that you can use it safely on a patient. Patient advocacy remains the important function of the professional nurse, and safeguarding patients' welfare, privacy, and confidentiality is paramount. Projections for the future. What we're going to see. Technology will continue to revolutionize healthcare. Like I've said before, my revolution in healthcare, in nursing, was the adoption of the computer. And I think your revolution in healthcare will be the addition of more AI products. Dichotomies will intensify. We just live in a world where we have differing opinions on things. So, we will have differing opinions on what is right and what is appropriate. Mobile electrograms will allow individuals to run their own EKGs and will allow nurses and providers to have more data in any emergent situation. I project that mobile electrocardiograms will be in place in long-term care facilities in the very near future. Breathalyzers will diagnose disease. All of these things are just coming out, and it'll be interesting to see how technology changes nursing in the future. For your activity this week, conclusion: biomedical information communication and knowledge technology will form a bond in the future, linking people and information together in a rapidly changing world of healthcare. Your activity for today has you thinking about what the future might look like with technology. What is something that you could imagine could be in place in the future when dealing with a patient, and what we're dealing with patients, their disease process, how we are managing supplies, how we are distributing supplies, how we are using technology in our nursing practice. So thank you and have a good day.